If I may, if Dave is still with us, I'd like maybe an update on where we stand with some of the COVID issues that we've been experiencing over the past week. I know it's been front and center here locally and, of course, nationally with the president's diagnosis. And so just was hoping Dave could maybe give us some updates and, of course, give a reminder that we all should be doing our part with masking and social distancing when and where possible, and just give Dave a opportunity to maybe walk us through some of that.
Sure, glad to. In fact, I spent quite a bit of time yesterday out at one of our nursing homes. So I'll back up a little bit in saying that what we're seeing in trends is less in community spread and more in congregate living settings. So we've had an outbreak at one of our nursing homes, and then we've had another facility that's like a halfway house that's had some spike. If you took those out of the equation, our numbers are looking good. So we have to really concentrate our efforts on those congregate living areas. Yesterday, I worked with both DOH infection control folks and DSHS staff, and went to Furlane and really went through the whole process. So we looked at the nursing home from when you walk in the front door and experience the whole thing. You go to the front door through the check-in pieces, and then what happens when you go to the yellow wing. So a yellow wing would be those people who come to the nursing home are sequestered for 14 days as new arrivals, make sure that they're COVID-free, and then they would move to general population. They are doing more testing. We worked with them yesterday on protective PPE measures, and went through and really watched staff using PPE, made recommendations, a few changes, and worked with them really closely. I went through the Red Wing with DSHS and Department of Health. Most everything looked good. We've made some minor changes, but minor changes can have large effects. So that's what we're looking at yesterday. Like I said, they've gone to more frequent testing. They're testing now every 5 days, so we'll be getting results sooner. And some of the staff is already through their, or by Thursday will be through their 14-day period and will be coming back to work. So we've had some questions on staffing issues, and we've got some PPE requests. So we'll be going out to emergency management today to pick up more PPE, dropping off there. That's certainly a relevant COVID expense. The hospital came over and worked with the staff to fit test everyone for N95s. And that was greatly appreciated, that the hospital staff took 2 of their people for 2 days to come over and make sure that all the PPE was appropriate and properly fit tested. So thanks very much to Mason General Hospital for doing that for us. I really appreciate that. We'll be following that very closely. Obviously, that's our biggest concern right now, is making sure that the residents are safe as well as staff. And I think we have a much better communication going now. We're talking several times a day. The things they have in place make sense. They're following guidelines, just needed some tuning on some things. And then of course, the PPE. As far as other things go, things that are on our mind. As with Halloween coming up, that's a source of concern. There's some new guidelines put out by the state on Halloween, and I've got a couple of community groups asking for some guidance. We're working on those. Schools are looking at a return to in-person learning. We're looking at the numbers. So the numbers, we were in the mid 60s. Our numbers are creeping back up when we take into account cases per 100,000, and these congregate setting outbreaks have pushed our numbers back up. So we may be recommending a temporary hold until we get those numbers back down again. And we've been reviewing the school plans. The school plans look great. I mean, people have put a lot of creativity and a lot of hard work into their return to in-person learning programs. In fact, I was just going to look at the schools this morning. We looked at a couple more. Our 2 private schools are fully open with in-person learning. So we're watching them. They've been open for 2.5 weeks now. So we'll be watching what happens there. But their plans look good. So on the whole, people are doing a lot of very positive things out in the community around COVID, and we're just taking care of things as they pop up. And then again, looking forward to this fall, we have the possibility of a flu vaccine coming out in November. That's going to be very limited distribution, and that will be primarily run by the federal government and be pushed out to the states with some very strict adherence standards as to who will be distributing and who will be receiving the vaccine. And then we're looking at probably in January, February timeframe, a more broad release of COVID vaccines. There's 5 different types coming out. The first type is a very cold storage. It's an 80-degree below zero storage. So the ability to handle that is restricted by people who can handle that sort of a vaccine. Further on, the vaccines that they're proposing will have much less restricted storage components, so it'll have a much broader reach as far as getting out to the general population. So just a ton of things happening in the planning stages. So we're still at the 60, 90 day out planning phase for a vaccine release. Concerns that we have are flu season. Flu season generally starts picking up the end of October into November. So influenza B, influenza A, and then COVID will all be possibly be happening at the same time. So we'll be looking at that. There is some thought for optimism in that we have people who are social distancing now and they're wearing masks, and that may actually provide for us a lighter flu season than normal. So that gives us some bright areas out there. And with that, that's kind of a quick nutshell what's happening in COVID.
All right, great.
Thanks, David. I kind of want to add on. So this right here is probably one of our best economic stimulus plans right here. Goldman Sachs said a mask could help save $1 trillion in loss to our gross domestic product. The Omaha, Nebraska Chamber said wearing masks could be as much as a $3.2 billion economic bounce to their regional economy. And so at the risk of raising some eyebrows in Mason County, wear a mask. It's okay. We'll get through this. But if you want to see businesses and schools reopen, we all have to do our part, and wearing a mask and is a big part of that. So appreciate everybody's work, Dave, in public health. So keep rocking and rolling.
Quick shout out to again, our nurses and our the rest of the health department. Everybody's working tirelessly and so dedicated to this cause. It's there's one way we can also help with, and I agree with Commissioner Schutte. Go to our stores, support them, and wear your mask so that they can stay open.